Donna O'Neill. Good morning.
Good morning.
Good morning.
Welcome back.
Thank you.
I have gotten smarter since your last appearance. And to prove that, I'm going to put these glasses on. Do I look smarter?
Sure.
Thank you very much.
Your arms just aren't long enough, eh?
No, it's not. So welcome back. What have you been doing?
Well, as you all can see, I've got new old hair.
I like that.
3 grandbabies.
Oh my gosh.
2 or less than 1. That's going to be important as we talk about measles later on. 1 new puppy.
Really?
Yeah, new puppy.
What's the puppy's name?
Ruthie.
So you have 2 dogs now?
No, just 1.
Oh.
Sorry.
Yeah.
Okay, so it sounds like things are busy in your world.
Yeah. And I went up to visit my mom in Canada. She's doing great.
Very good.
Yeah, they've got measles up there too.
Do they? Let's talk about measles, should we?
Eventually, sure. Just make sure we have time.
All right, well, first of all, you started with us as the COVID expert and helped our community through the pandemic. Thank you for all that. And we've had just recently some of your patients have written to say, you are the best doctor they've ever had. You've saved people's lives. It's, so we can't say their names because of HIPAA, but we've been hearing from people and they want you back on the show. So glad to have you back.
We're happy here
Here
today.
I am.
So
the pandemic, but we're still having COVID cases. We're
Correct.
still seeing them.
Yeah, so actually there were 6 deaths this year so far
Really?
due to it
In Jackson County.
in Jackson.
Wow.
And are you still treating people as much?
No,
or-
we don't have the monoclonal
Sure.
antibody. There is a preventative antibody for immunosuppressed hosts, but not all insurances pay for it. So, there's lots of immunity out there, so it's not affecting us the way it once did.
You brought a video. Did you bring a video?
No, I didn't.
Well,
I did bring
we
some
have a video
slides for
clip.
me. Yeah, I
Sure.
didn't bring a video. This is going to be
Yeah,
embarrassing.
we did bring a video clip.
This is going to be embarrassing.
Let's take a look.
Are we early enough in all of these shutdowns and lockdowns?
Time will tell. I'm not the expert. Time will tell. I think that we can do more. Perhaps we should assume that right now everybody, has been exposed and is infectious. And then maybe that will encourage everybody to stay home. A lot of the talking is done up front, again, from my staff. So some of the patients said, man, you guys are efficient. We do a lot of the check-in out in the parking lot because we have to keep things moving. So there's some, we'll get to it hopefully at the end of the show, some of the newer therapeutics that are coming along.
The boosting a car, that's the Canadian version of jumping a car.
Oh.
Here that means stolen.
Okay.
Infectious disease specialist from the PIIC Center, Dr. Donna O'Neill. Good morning.
Good morning.
Good morning.
Sorry, I'm going to talk about COVID again. The impetus for today's talk was a patient yesterday in the clinic.
Okay.
Late 80s, getting the monoclonal antibody, pretty sick. I think she had early pneumonia.
Oh, wow.
And she said to me she's under-vaccinated because her last dose of the vaccine was last November, and she hasn't had any illness this year. And she said she didn't know there was another vaccine out there and that she should get vaccinated.
Can a community, an area be an island of better outcomes?
I hope so. That's the point I'm trying to make today. And I think we're small enough we should be able to do that. And we're not going to be perfect. We just need to support one another and encourage to do the right things, make the right choices. It was an interesting question. It came up in our team huddle yesterday because that's what patients are saying. Is it gone? And there's not a really good definition for it. There's no good metrics for it.
Sure.
And I think it depends if you're a physician, if you're a teacher, if you're a business person looking at the economy. But to be honest with you, Brandon, what do you think? Is the pandemic gone?
No, absolutely not.
Okay, well, because, I think a lot of people have decided it is. This is only going to work if we all cooperate, if we all listen, and if we all do our job. And right now our job, Jackson, is to stay home. But before we start, question for you guys. It's an easy one, Andy.
Okay, well.
Do you think the pandemic is over?
Technically, no, it can't be over.
Okay.
No. What's your line of the week? How about, I had a reservation.
I didn't bang on the table.
So I have to tell you, Ted did the same thing once. So I'm sure a lot of people have done
I'm
it.
pretty sure everyone's done it. That was fun.
All your predictions came true.
Yeah, you were right. Yeah. Very smart. Very, very
I
smart.
don't know about that. But when you think about it, a lot of people died as a result of COVID. You know, in the world, 7 million. In the U.S., 1.2. Michigan, 45,000. Jackson, 721. It could have been a lot worse.
Yeah, I agree.
Thanks to Operation Warp Speed and using the Defense Production Act. You know, we got a vaccine out there fast. And it brought our community together, but it's also shown some divisions.
For sure.
Which probably still exist. It showed me the impact of social media. A lot of misinformation. Still a lot of misinformation about measles.
Yeah.
And as a result, we got behind on our vaccines, and that's impacting us with the measles.
Yeah. We'll call it a 5-year period, did it feel like it was a 20-year period, or did it feel like it went by like that, because you were just so busy?
We were really busy, so caused a lot of burnt out amongst healthcare people, because we all worked. Everybody got to stay home and make their banana bread and clean out their shelves, but we all worked. So it was hard. We gave, I think, over 1,800 doses of the monoclonal antibody, and not just from Jackson. We have people coming from all over the place.
Oh, yeah.
And I've never seen so much pneumonia in young, healthy people in my entire life, and hope I never do again.
Scary. Measles has been in the headlines.
Yeah, so I think I talked about the R naught when we talked about COVID, but measles is one of, if not the most contagious infectious disease out there. If you haven't had it and don't have a current vaccine, and 90% chance of getting it. Here's some pictures. It really affects our little ones. They really get hit hard. They're miserable. They don't eat. They're crying.
What are the...
These are little Koplik spots that occur early on. And if you see it, that's pathognomonic. It makes a diagnosis. But this is the rash.
What are the symptoms other than the rash?
So it starts off with a really high fever, and of course you don't feel well, and you don't want to eat. And then you get the rash, starts from the scalp, goes all the way down. Once that's happening, the fever goes away, and it's really high. It's up to 104, 105 degrees. Then the rash goes away. You have the 3 C's. Remember that? Conjunctivitis, which might be a clue, red eyes. They get cold-like symptoms and a cough. Fortunately, it doesn't kill a lot of people, but it still kills, and unfortunately it's killing healthy young children here in the United States. The incubation period is usually 1 to 2 weeks, can be up to 3 weeks, and of course they're contagious before they get sick. So 4 days before the fever and 4 days after the rash, they're still contagious.
Have I had measles?
Yeah.
Have I have?
Yeah, you've had a vaccination.
Have I had the measles vaccine? Yeah, of course I have. Have you had measles?
Well, he was born before 1957, so he's immune. I'm assuming
immune.
you were born
Just
before that.
barely, 1956.
So he's immune.
Okay.
So,
Oh, that's nice.
Yeah.
You perked right up.
and when were you? So
1982.
okay, you're safe. So there's
All right.
well, because there have been a lot of questions about booster doses. So you need to know a little bit about the vaccine. It came came around in 1963, and initially there were 2 types: the killed and the live attenuated. And the killed didn't work. So people between 1963 and 1967, they don't know if they've been vaccinated, let alone which vaccine, so they could still be susceptible. So some people may need to get a booster dose, but right now in Jackson, we're not in an outbreak.
Okay.
So that makes a big difference. There are some high risk groups where the recommendations don't apply, like healthcare workers, we all get tested, because if we're not immune, we have to get vaccinated. Kids going off to college, international travelers, because there's a lot of this disease in countries like India, Thailand, Indonesia. But some people are asking their family doctors about booster doses. So if you're born before 1957, don't worry, you've had it, probably through a natural infection. And After 67, you should be okay. So for that group in the middle, you don't really have to get vaccinated right now because we're not in an outbreak. That could change, hopefully not. But if you want to, go ahead because the vaccine is safe. It does not cause autism. There have been 15 studies in 6 countries that have shown that. The data was fraudulent. It's been pulled off. The vaccine doesn't cause deaths. What you can get from the vaccine, believe it or not, is in about 5%. They can get a little fever and a rash. They are not contagious. It quickly goes away. And rarely, some people get a drop in this teeny tiny cell called a platelet, and they get a funny little rash. It's like 1 in 35,000, not important. But it doesn't cause deaths. It is durable, and that's why in 2000 we finally said, hooray, in the US, we were free of it. That probably will change now because of the big outbreak in Texas. And unfortunately, Texas, 2 children have died, unvaccinated, totally healthy. And I don't know, talking to patients over the years, that's probably the worst thing that can happen to you. You lose a little bit of yourself when you lose a child, and totally preventable. And it's spreading. I mean, every time you open up, Ohio has an outbreak. I told you Canada does.
5 cases in Michigan.
But they're not linked.
Right.
So we're not in an outbreak.
Yeah,
correct.
That's good.
So there's no treatment. Once you get it, you got it. If you get hospitalized, you get fluids. The WHO says everybody should get vitamin A, but it's debatable in the US if your nourishment is okay, if you need it. Pneumonia is the biggest cause of death, and that's why in the 1940s, when the antibiotics came along, the death rate also started to go down. But the vaccine really dropped the death rate for measles. And we'll see what happens next.
And it's so contagious that you could be walking across the street from someone, conceivably 30, 40 feet away,
Well, not you or I.
and the air droplets could.
You're more at risk when you're indoor,
That seems a little-
but if you're in a room where a person's had measles,
It happened in a stadium.
You're-
Dr.
I heard, yeah.
Bart got sick at Disney, and now everyone's
But if you're
spilling droplets.
when a person leaves the room, and let's say they're incubating measles, 2 hours later you can still find the presence of the virus. So it's very contagious.
Okay.
So
Well, I mean, that's a little different than walking across, the other side of the
In a
street.
stadium, there was a case, somebody in a stadium, and then people across the way
Yeah.
got measles.
What else do you think people had in that stadium?
There were, in Ingham County, there was a 1-year-old, and they are trying to contract trace
Yeah.
that person,
Yeah.
unvaccinated.
So if that child was in daycare, there could be other cases.
Well, it was great to have you back. Thank you so much.
Thank
Will you
you.
come see us again very soon?
Will do.
Dr. Donna O'Neill, infectious disease specialist from the PIIC Center. More of the morning show. Stay with us.